Hi everyone, I'm Dr. Paul Black, and I'd like to welcome you to Bettendorf Sleep, my newest venture here in my practice, Perfect Impressions Dental Center. Those of you who aren't familiar with dental sleep medicine, it is an alternative to, for instance, the CPAP machine. The CPAPs are well known, but what you might not know is that there are appliances that dentists make that can solve many of these issues that you're experiencing at night. We all know somebody who snores. In fact, I'm certain there are people out there who have heard their significant other or spouse literally in the middle of the night gasping for air. These are serious issues, and we are now able to not only screen but diagnose these issues right in the dental office.
My husband had repeatedly told me that I snore quite loudly, or used to snore quite loudly. Even so bad as he would be in the other room watching TV while I was sleeping, and he would have to turn the TV up because my snoring was so loud he couldn't. And I tried different kind of over-the-counter things, but of course, none of them worked. And I thought, okay, I just need to really try this.
We initially do is we screen people to find out what their symptoms are and find out if there's potential obstructive issues in their airway. We have some very specific equipment that we do this with. We have sonar-based testing to find out exactly what their airway looks like. And we also are capable of administering sleep tests to patients directly through our office. Once we have found out what the issue is, if it's simply snoring or if there's snoring and obstructive sleep apneas, then we can fabricate an appliance that's very specific to actually creating a better solution for the patient. We use digital impressions to make an appliance, which is much different than the gooey impressions that you're used to, so it's very precise. This is an example of an appliance. The appliance actually fits on the upper and the lower teeth, and it has a small arm in between it that's adjustable. Normally, I adjust that arm, so there's a couple of different components to this appliance that make it different than everyone else's appliance. First and foremost, we're developing a vertical dimension, or how open or closed you should be in order to get the maximum airway. And then secondarily, I can adjust this arm forward or back to determine how far forward we need to bring you so that the tongue comes along for the ride and opens up the airway in the middle of the night. These appliances are exceptionally well-fitting, and they really make a huge difference almost immediately in the patient's quality of life.
And I trust Dr. Black. I've been coming here for over 25 years now. I mean, they're like family. I love them. And this little thing, in just 2-3 days, I got used to it. And I go to bed at night, I pop it in, and you don't even know what's in there. It's amazing. It's my new best little friend.